It is a pleasure to have with me today Dr. Gigi El-bayoumi. I mean, she's a great human being, but on top of that, she is an amazing physician. She is the director of the Rodham Institute, the professor of medicine at Georgetown, all in Washington, D.C. And Dr. Gigi El-bayoumi, thank you for joining me today.
My pleasure. Anything for you, Ms. Ryan?
Ah, that's sweet. So listen, we're in a crisis state. We've got the CDC and the health department and other places, people leaving, well, being fired. Then on top of that, not only are they being fired, before they were fired, ever since like the beginning of the year, since this administration took office, they've been muzzled from talking about any diseases from measles that's spreading like wildfire in this country, from measles to the flu outbreaks, A and B. A is more akin to COVID. I've had them both since January 29th, and it wasn't pretty. COVID is on the rise. There's something else on the rise. And they were saying that people should be wearing masks. And the crazy thing is, you don't hear this. We're not hearing this. So, as a health professional, as a serious health professional, as someone who understands the dynamic of diseases, things on the rise, how to mitigate it, etc., and how to treat. What are you saying in this moment? Because we are not getting what we need from the federal government.
Well, there's a lot to say. First of all, I'm of Egyptian heritage. There is a reason that Egypt, as an ancient, civilization, lasted for millennia. And the reason was the state was intact. They never played around with the state. And
Mm.
what you're seeing is all of the state institutions, the health institutions included, are being dismantled. They're not being dismantled, they're being deliberately destroyed.
Yeah.
If it was being a matter of dismantling or trimming or any of that, it would be a different process. This is just taking a sledgehammer. So, what's happening is that it's irresponsible, it's unethical, it's immoral, and it's illegal. I mean, every way you can look at this because these you cannot just unilaterally do this. But the reality is, this is where we're at. And how can we deal with it? What are the real issues behind this? And what does the future hold? And what kind of practical advice for us as individuals, family, community, what can we do to protect ourselves? And that's a lot.
Well, I know the symposium or whatever they had for the flu for the coming year has been postponed or canceled, and we haven't heard anything about a new flu vaccine. Um, and some people died this year from the flu, if I'm correct. Um,
They always die from influenza, about 50,000 people a year, which is a preventable disease. It's the equivalent of having four jumbo plane crashes every day. So yeah, I mean, so look, the messaging may not have been perfect in previous administrations from the CDC. I think it's not friendly and so forth, like the example that I just gave you. I bet you most people don't know that. And yes, yet it's such an easy example to give. But let's talk about, sort of what the important pieces of the infrastructure need to do to protect the public. First of all, public health is very important. And unfortunately, our society is not doing a very good job. It's never been looked at as something to invest dollars in. I'll give you an example. In India, with people who have TB, you have to make sure that they're taking the medicine okay, right? So you know what they do? The people that are on the corner selling cigarettes in a kiosk, they have them give the TB medications and they get paid a little bit and they check off because it's so much easier to take care of people where they are, right? So, our structure for the public health structure is weak, and over the decades, there has not been enough. But there are many factors that go into why are we getting so sick. So let's talk about falling in love. Do you know that when you fall in love, your immunity improves? You
Really?
actually, it gives you a boost so that you don't get sick.
Really?
That's what happens when we break up, the opposite. Now,
Oh.
what we're going through collectively, especially people of color and others, is that it's like we're breaking up all the time because of the craziness that's happening. So, we know that stress it definitely impacts the immune system. And people are, our sleep is off. I don't know about you, but lately I keep waking up in the middle of the night. When I'm stressed, what do? I stress eat. Am I
Mhm.
exercising? No. The work, for people who don't know if they will be fired or not be fired, that uncertainty, and then you have to deal with being fired. And don't forget, there's the term vicarious trauma, which, is when somebody gets shot and the family, but this is vicarious trauma that we're experiencing. I mean, when I look at people who no longer have access to food because the food bank money has shut down. I mean, what does that do to their mental health? It turns out that food is the number one social determinant of mental health. So if you're not there mentally, what's happening to your immune system? You're not getting enough food. All these factors come into play. And then there's another very big factor, which actually has to do with climate change, which was just denied. So it turns out that one of the reasons we're really seeing all of these viruses is because of climate change. Did you know that it's predicted by 2030, which is only 5 years away, that Washington, D.C. will be endemic for malaria? So all these
So when
diseases,
that,
yeah.
that for you, that's common terminology. Endemic. What does that mean
Oh,
for us? Yeah, for the layman.
thank you. Thank you. Thank you so much. I try not to use jargon, but obviously it slips in sometimes. Endemic means that it is not just a case or two, that it's actually in the community and spreading. Okay, that's just a simple way of explaining.
Malaria.
Malaria, right? Malaria,
Mosquito bite malaria.
mosquito bite malaria because the mosquitoes are going further and further up. Another mosquito-borne illness, which is dengue, which anybody from the
Dengue
Caribbean,
fever.
it's awful. You get these severe headaches, West Nile virus, all these mosquito-borne diseases, right? So you see, you can't take anything, especially illness or health, out of the out of context. Everything is interconnected, as you know, whether we're talking about society as a whole. So you can't just say, oh, it's the vaccines. No, it's the health of the individual, their access to food and, housing and all that. It's the ecosystem in which they work. What does climate have to do with everything? It has everything to do with everything. Look at this season this year. This is going to be highest pollen count, and people are having more severe allergies. The cherry blossoms, which are beautiful, are blooming earlier and earlier, right? We're now into just winter and summer, and sometimes they're within the same couple of days.
Exactly. There's no in between. There's no gray area. And and because like you said, we had a harsh winter with a lot of wetness and snow. So that gave moisture, needed water to a lot of the vegetation out here. And it's now blooming. It's blooming. And the summer before that was hot. So
Right.
I've always said when it's hot, when there's one extreme, it's going to be another extreme on the other season. So
Yeah, and I don't know about you, but I feel like I'm riding a bucking bronco every day. And the weather, I mean, yesterday it was 82. This morning it was 40. So when we think about us as human beings, right, we are also dependent our circadian rhythms, right, our internal clock. It turns out there's not just one clock. There are actually something like 12 clocks. And when those are thrown out of whack, they have consequences. So I'm going to tell you something that's related, which is really interesting. I just learned. Do you know that in Europe they put a limit on the number of years that people can work overnight shifts to 5? And the reason
it cuts your lifespan. I used to
it
work.
increases your cancer risk.
Really?
So who's working those night shifts? Let's think about it.
Us, people of
Right,
color, people
right,
low
right.
means, people who
Yes.
have
And
to work those
right.
shifts.
and certain professions, nursing, for example, security. So, you think, well, that's has nothing to do with
Deliver.
it. It has everything to do with it.
Wow.
So, mhm.
So what do you say to the average person right now who's upset in the midst of this? They've got underlying issues. There's COVID on the rise. There's A and B flu, measles, other things coming. And the health department is slowly closing down.
So I would say, how I've been dealing with all this craziness is I say, become hyper local. There are lots of resources on our various communities, whether it's expertise at every level. The churches are a really good source. There are people in the communities that can help educate. I think having educational sessions such as this, answering people's questions, but all the things that our grandmothers taught us, we should follow. Just, you
Well,
know,
my grandmother told me when I had a cut to put a cobweb in there. I don't think that's safe anymore, but and put
well, I mean, look, there may
more
be there
area.
may be something to that, but remember when we were growing up and they would say, make sure that you wash behind your ears and your
Yeah.
neck. Well, guess what? They did a study on that. And if you do that, you're much less likely to get sick with colds and flu.
Okay. All right.
Right. Who knew, right? The eating is really important. And I told you my challenge, and I'm stressed, I stress eat, and it's not the healthiest of food. So the basics, getting enough water, getting the eating as much colors that you can. Al
Yeah.
Alcohol is another thing that depresses the immune system,
Yeah.
which is something that people turn to just to feel better. Sleep, sleep,
Mm.
sleep, sleep is so key. Do you know that most of the rest of the global south, sleep is like a cornerstone of good health. And here, especially in DC, people brag, oh, I only get 4 hours, 5 hours. It's like, are you nuts?
It contributes to obesity, high blood pressure, hypertension, all of that stuff, and diabetes.
Dementia and cancer.
Mm. Okay.
So we're talking about, making sure that you're drinking enough water, sleeping, eating the best that you can. I think that when we're stressed, we also have to give ourselves some grace. But guess what will also help your immunity? One of the things that we really lost during COVID is the social interactions. And when they looked at our brains, they studied over the 3 years, our brains actually shrank. And because, let's think about this, we as human beings, if you believe in evolution, we evolved so that when I'm talking to you right now and you talking to me, the dopamine, that feel good neurotransmitter that bathes our brain, go up. We feel better. Social isolation kills, it affects your immune system. So, an answer to sort of protection is to be having meaningful relationships. They don't have to be long-term relationships, they don't even need to be deep. Guess what they've found? If you get on an elevator and say good morning and just that chit chat, or you chit chat with the person delivering your mail, that actually increases your life expectancy.
Mm. Okay.
Yeah, so social interaction, minimizing alcohol, and doesn't matter what kind. Beer, wine, and hard liquor are the same. There's no
Okay.
difference. Okay. Smoking
So
is
the brown liquor is just as bad as the wine. Okay. Well, the wine is
as
just as bad as the brown liquor. Okay.
or the beer is just as bad because remember, a shot is higher concentration of alcohol. A glass of wine, you're making up for it in volume, and a beer.
Wow.
And by the way, for women, 7 drinks maximum a week. Otherwise, the cancer risk goes up. 14 for men, of course, because they metabolize it more quickly.
So let me ask you this. Let's say next year, next flu season, we don't have vaccines. We have an anti-vaxxer as a Secretary of Health and Human Services. What do we do to protect ourselves?
Well, I think, one thing I did not mention is the hand washing. I'm around a lot of sick people
Yeah, you
on
are.
a daily basis, but I am compulsive about washing my hands. I never get sick from a patient. I always get sick from my family. Always. I don't get sick, thank God, very often, once a year, but it's never from my patients. So think about it. All I'm doing is washing my hands. So,
But around your
growing.
family, you relax a little
Yeah,
bit.
exactly. But
Okay.
growing up, when we would come home from school, wash your hands. That's the first thing that we did. Wash your hands and wash your face.
Mm.
So these hygienic health habits are really important. Also, I noticed that people tend to keep towels around longer and they're damp. Change the towels, change your bedding. If there's somebody that's sick, you gotta. And then guess what we do in Egypt? We open up the windows. I don't care how
Oh
cold,
yeah,
you gotta air the place, right?
yeah.
So
Let it.
some of these, they're really African habits and things that our grandparents, our grandmothers really taught us make a difference. They really do. So we have to get back to basics.
Yeah. So some nights I have the windows open. Some days I do, some days don't. But one thing, sometimes in the morning, I just open the door to bring in the fresh air.
Absolutely.
Problem, but in the mornings when I get up, I just welcome the fresh air. Just let it air the house out, air the
Exactly, because
air
it
the
has
space.
that. There's a word in Arabic which I think is ancient Egyptian, and it's called kemkema. That kemkema. It's just like you got to air it out so that it goes out.
Air the house out.
Air the
let
house
the
out.
let the air go through, let the wind go through everything.
Ventilation.
Yes. Yeah, yeah. So
But you have to be careful if you've got allergies because the pollen will come in. So it's like a
terrible
balance.
allergies.
It's a
Terrible.
it's always a balance there. But the other thing that some people do, I don't tend to do this, is they will touch their face a lot. That's why the washing back here is so touching your face, and then these evil things.
Oh my gosh, yeah. We need to
Y-
wipe those down more than what we do.
Yes, yes, and I'm guilty, but I try to. Or if you have those covers like I do, change the plastic periodically. The protective cover of the phone.
Yeah, mine is cracked, so I'll probably have to do it anyway. So
Yeah.
my
So
protective cover is cracked.
yes,
Also,
yes.
yeah.
Because that also has a lot of dirt. You know what else you can do? Keep your nails short. Cut your nails.
Okay.
Or
For
clean
women,
them.
that's gonna be because you
But
see.
wait. I know. But what you can do, those little brushes?
Mhm.
You can brush under there because that's where a lot of bacteria can also collect. So you don't have to cut them, but you can clean them.
So we're going back to basics
Back to
because
basics. Yes.
the big thing is being pulled away.
Right. And so you asked what else we can do to protect. I think sometimes in our society now, everything's gotten so individualistic. Like I saw somebody the other day and they declined the COVID vaccine, which is their right, of course. They're young. I said, but your grandmother is going through cancer treatment. That
Mm.
we need to kind of think more collectively instead of, well, I'm going to be fine because I can take the medicine and blah, blah, blah. Yeah, but what about other people in your sort of your community?
And that's the thing. People don't understand. When you go through chemo, it strips all the COVID vaccine out. You're more susceptible after chemo of disease and stuff. And
So
if
what happens there, because I want to add something, you make a very good point. When somebody has chemo or any kind of their steroids for lupus, or if they're older, because as we get older, our immune system decreases, but you don't get the full benefit from the vaccine if you didn't have any of those things.
mm,
People that give the best immune response are actually young people. And that's why they may have more reactions to the COVID vaccine, right? Versus older people, they may or may not.
okay. Wow. Is there anything else? I mean, because we've touched on a lot of topics, and this is just one of those times of concern, great concern.
Well, I want to tell you that the mental health piece is huge. I have never seen so many people, but like I've had several people that have been sober off of alcohol for decades or sober from, substance use, and people are really relapsing. And so we have to, first of all, not be judgmental because just like I hope people are not judging me when I eat junk food, even though I'm a doctor and should know better, that these are coping mechanisms. It's always important to get underneath and really understand what it is that is causing people pain, that they do relapse. So I would say checking on each other. I mean, whatever happened to my brother or my sister's keeper, I don't know what's happened to that. But we have to, taking care of others is actually taking care of ourselves. We
Yes.
we do better. Actually, I was just reading, Jane Fonda came out and said, why, what is her secret to staying young looking other than having an excellent plastic surgeon? Right? No, no, she's very open about that. If I were to ever have plastic surgery, I would want to go to her person because she doesn't look kind of freakish like some of the other people do. But what she said is,
Looks more natural. The only place I can tell it is around the hairline. Good.
yeah.
Yeah.
So basically, she said having that positive attitude,
Yes.
smiling. Do you know that when you just smile, that actually improves your mood?
Really?
And people who are depressed, they will actually they've done this experiment or research where they actually will put something to make them smile. They get better quicker. I think we should be more generous with our compliments to other
Yeah.
people,
Yeah.
you know.
We are we're battling we're battling for sanity, we're battling for health, and we're battling so many things at one time. It's easy to fall down. Since COVID, since the beginning of COVID, it just seems like it's this roller coaster ride. And everybody's looking for some magic wand that will fix it. And they're reaching, far reaching, and it's not working.
Yeah.
Gotta
Well,
reach.
you just brought something up which I think is very important, and that is people are looking for a quick solution. That's what Americans do, right? We want that. I want
Mhm.
something instant. But the reality is, if you make small changes in many areas, you're going to
Yeah.
see a difference. So, tweaking here, I saw somebody that's having difficulty sleeping. I said, okay, I want you to just try because she sleeps at like 9 in the morning and then wakes up at 3. I said, well, we need to shift your schedule. Try to stay awake for a half an hour longer
Mm.
next week. So you shift to 9:30. And then of course, time flies by so quickly. Before you know it, in a couple 3 months, her sleep, she wants to just shift it, would have but I also want to say this, as horrible as it is right now, and as horrible as the people who are really suffering and are going to continue to suffer, I actually, believe it or not, I'm optimistic. I'm optimistic, and I'll tell you why. I'm optimistic because what I'm seeing in communities is going back to things that were working. Communities, there's a lot of great leaders in the communities, and they are just saying, you know what? We're going to do this ourselves. They've been saying that. I mean, I don't want to make it sound like this is something new, but I think that that's something. And then, as awful as everything that's happening, it's actually removed the veil to show the real face of corporations, capitalism on steroids, the roots of what the society was built on. My dad, and I'll stop talking. My dad always says, this country was built on three things: violence, racism, and greed. So, we elected Obama, right? Which was wonderful, but that's just trimming the treetops. It does nothing for the roots.
Mm. And we elected Obama, and then look at it was polar opposites.
Backlash.
Yes, blacklash. Let's try that. Black.
Hey, hey.
Yeah.
Yeah.
Well, you're,
I just learned a new term. You may know it. The caucasity. Have you heard?
the caucasity of it all. Yes, I love that. I learned it over the summer. And I'm like, oh, and I've been saying, yes, the caucasity. It's been, yes, not the audacity, the caucasity.
The sad thing, though, is that, the racism virus is so strong that people who are, voting against their own interests are impacted by these things. I mean, the DEI is a great example. How many white women have been promoted?
Military, pregnant women, all, and yeah, yeah, they thought it was going to be us. But I wish, you say the racism virus, I really wish there was a pill or a vaccine. I really wish there was a shot that we could give and it would stop.
There is something called education and community building, because guess what? I mean, I'm of an age where I remember about, LGBTQ plus and how people were closeted. The minute that people started intermarrying or having members that they realized were out in their families, all of a sudden attitudes about LGBTQ shifted. They're not completely whatever, but they shifted. So it is important that we educate and
Mhm.
that we advocate and that we really try to just hunker down during this time. And then I think also it is important to take care of ourselves, because this is a roller coaster. We sometimes just need to disconnect. And this thing, we need to disconnect from this. We can't all the time, but sometimes.
Double-edged sword because this puts us
I
in that.
know, I
So yeah,
know. Well, I mean,
I
it's like anything, right?
yeah. Well, listen,
Moderation.
I appreciate you always, Dr. Gigi El-bayoumi, of the Rodham Institute and also Georgetown Hospital. I'm just, I'm thankful. I'm thankful for you. I'm thankful for your knowledge. Um, we are in a moment, and I'm just wondering what the summer brings. I mean, even though we're outside, who knows? I mean, this doesn't, it's beyond the seasons now. It's beyond, it doesn't care. Person, race, gender, it doesn't care any of it. So, like you said, climate change is bringing it on. We have to start really believing in what's what.
Science. And
Science.
science. So
Yes.
speaking of that, because I forgot to tell you about the whole nonsense about vaccines and autism and kids. So guess what a risk factor is for autism? There are two risk factors that have been shown to be emerging. One is advanced paternal age.
Yes.
Okay, and we can think of some examples of people that we see publicly that may fall into this. And then the other one is Tylenol use by women during pregnancy.
Really?
There was some initial research, but now the research is more robust.
I
As
was
opposed, yeah.
low pressure system or something. I'm like, huh? But okay, wow.
Well, the thing is that for years, right, doctors have been telling women, you can't take Advil, you can't take Tylenol.
Mm,
So that's something that's been seen. So like anything else, anything that you ingest or a medicine or herb, there is a risk to it, right? But what we have to look are, to teach people about the concept of risk benefit. So, yes, there is a risk to anything, but what is the benefit and what is the potential to avoid harm?
yes.
So, anyway, people just have to, it's common sense. You don't have to be a doctor at all.
It's common sense for some and a light bulb moment for others, unfortunately. But I mean, it's good information in this moment of a lack of information on health. And I'm so glad that we have people like you to help navigate in layman's terms what we can do and just practical approaches. It doesn't have to be all grandiose. We don't have to microban our house down and all and put plastic wrap around it. Wash behind your ears, wash your face and your neck, wash your hands, scrub your nails, just basics. We'll
Yeah, can I tell you who does this kind of education much better than doctors?
who
Nurses. Nurses are the real angels on earth, let me tell you. They can speak much less jargonesque language. They have a heart, a real heart for healing and taking care of people. Nurses, if we really cared about health and public health, nurses would be elevated, right?
Mm,
Matter of fact, I'll say this. I love pyramids, but there's no place for them in health or healthcare. We should use a circle or a wheel where the individual, the family, the community is in the center, and everybody, we're all equal spokes. A
mm,
physician, a technician, a nurse, the person wiping the floor, the person that's transport. We're all the same. Pharmacists, we're all the same. There should not be this hierarchy because physicians probably we do the worst job in terms of communicating with our patients, especially these days with the pressures of writing notes and all that kind of. We've lost the plot.
wow.
Mhm.
Yeah, and a lot of doctors, we keep keeping this conversation going, but a lot of doctors after COVID left. You say we lost the plot. There is a shortage in healthcare right now, nurses, doctors. So yeah, that this is
Oh, one in three physicians over the age of 50, and this is old data, left the profession and more are leaving. You know who's staying around?
who.
The ones that can get lots of money from the procedures. You know that a dermatologist that just finished her residency can put up a shingle and make $1 million a year.
Mm, the big equipment. Okay. All right. Well,
So orthopedists, people who have, but, and we think about it like me as a general internist, it's mostly women that are in the pediatrics, internal medicine, family medicine. So what happens as soon as any profession becomes, feminized, prestige and pay go down.
oh my Lord.
Yeah. Anyway, lots to talk about.
Lots to talk about, lots to take in. Dr. Jehan El-bayoumi, director of the Rodham Institute and professor of medicine at Georgetown. Thank you so much. We
My
appreciate
pleasure.
you.
My pleasure.
We need this conversation because I'm concerned. Um, I had the flu B and then flu A since it from January 29th. And
It's no joke.
yeah, every people are getting like everybody's got the flu. Yeah, it's a big deal. So that's why we were asking why is everybody getting sick. So we got some practical information of what to do and talk to your doctor. And if your doctor doesn't talk to you, you may want
Talk to a nurse or
to.
your pharmacist.
Yes, talk.
Or go and read or talk to anybody else. We had a program through Help Age USA, Grandparents Against COVID, and they learned, basically went through education.
Mhm.
Every grandparent, they were able to get 6 people vaccinated.
Wow. It's something about a grandparent and their persuasiveness. Dr. Jehan El-bayoumi, thank you so much. I
My
appreciate
pleasure. Thank you.
you.
Bye-bye.